Question 1. A nurse is educating a patient newly diagnosed with eczema. Which patient teaching is most appropriate to reduce skin damage from scratching? A. Apply warm compresses to the affected area. B. Encourage daily long hot showers. C. Teach the patient to keep nails short. D. Recommend using fragranced lotion. Answer. C. Teach the patient to keep nails short. Question 2. Which task can the nurse safely delegate to an LPN caring for a patient with atopic dermatitis? A. Assign a UAP to apply prescribed steroid cream. B. Instruct the LPN to monitor for skin infection. C. Ask the UAP to assess moisture levels of the skin. D. Delegate the RN to change linens for eczema patient. Answer. B. Instruct the LPN to monitor for skin infection. Question 3. What is the best nursing intervention to maintain skin hydration in a patient with eczema? A. Apply emollients immediately after bathing. B. Use antibacterial soap during bathing. C. Bathe the patient twice daily with hot water. D. Avoid moisturizing creams during flare-ups. Answer. A. Apply emollients immediately after bathing. Question 4. Which patient should the nurse see first during a dermatology follow-up visit? A. A patient with mild eczema itching, controlled by lotion. B. A patient reporting honey-colored crusts on eczema lesions. C. A patient requesting refill of topical emollient. D. A patient whose eczema is improving with treatment. Answer. B. A patient reporting honey-colored crusts on eczema lesions. Question 5. Which statement by a patient with eczema indicates a need for further teaching? A. I will moisturize my skin right after showering. B. I should wear loose cotton clothing. C. I'll take long, hot baths to soothe itching. D. I need to avoid harsh soaps and detergents. Answer. C. I'll take long, hot baths to soothe itching. Question 6. The nurse is caring for a patient with severe eczema. Which intervention is most important to prevent infection? A. Encourage frequent bathing with antibacterial soap. B. Keep fingernails short and clean. C. Apply topical corticosteroids as needed. D. Recommend wool clothing to protect skin. Answer. B. Keep fingernails short and clean. Question 7. A patient with atopic dermatitis is receiving education. Which instruction best supports skin barrier protection? A. Use mild, fragrance-free soaps. B. Take hot showers twice a day. C. Exfoliate skin weekly. D. Avoid moisturizing daily. Answer. A. Use mild, fragrance-free soaps. Question 8. Which action by a UAP requires intervention by the nurse when caring for a patient with eczema? A. Helping the patient change into cotton clothing. B. Applying emollient cream after bathing. C. Using scented soap to clean the patient's arms. D. Reporting the presence of skin redness. Answer. C. Using scented soap to clean the patient's arms. Question 9. Which dietary recommendation is most appropriate for a child with eczema and food sensitivities? A. Eliminate identified trigger foods. B. Increase intake of spicy foods. C. Avoid drinking water with meals. D. Focus on high-sugar snacks for energy. Answer. A. Eliminate identified trigger foods. Question 10. A nurse is assigning tasks to a UAP for a patient with atopic dermatitis. Which task is appropriate? A. Apply medicated ointment to rash. B. Teach patient about flare-up triggers. C. Assist patient with dressing in soft clothing. D. Evaluate response to prescribed treatment. Answer. C. Assist patient with dressing in soft clothing. Question 11. A mother of a child with eczema is concerned about itching at night. What is the best nursing advice? A. Apply emollient before bedtime and use cotton gloves. B. Bathe the child with hot water before sleep. C. Use perfumed oils on affected areas. D. Dress the child in tight-fitting sleepwear. Answer. A. Apply emollient before bedtime and use cotton gloves. Question 12. The nurse identifies a secondary bacterial infection in a patient with eczema. What finding supports this? A. Clear fluid oozing from rash. B. Thick yellow crusts on skin. C. Skin appears dry and flaky. D. Itching worsens at night. Answer. B. Thick yellow crusts on skin. Question 13. What instruction is most important for a nurse to give when applying topical corticosteroids for eczema? A. Apply a thick layer to the entire body. B. Use only on inflamed areas as prescribed. C. Use corticosteroids daily for prevention. D. Stop applying as soon as itching subsides. Answer. B. Use only on inflamed areas as prescribed. Question 14. Which patient behavior requires follow-up regarding eczema management? A. Applying lotion after showering. B. Scratching affected skin with untrimmed nails. C. Wearing soft, breathable fabrics. D. Using prescribed topical medication. Answer. B. Scratching affected skin with untrimmed nails. Question 15. The nurse is evaluating understanding of eczema care. Which statement by the patient indicates correct knowledge? A. I should apply lotion before I bathe. B. I will avoid using any moisturizers. C. I should apply lotion immediately after bathing. D. I should use hot water to open skin pores. Answer. C. I should apply lotion immediately after bathing. Question 16. In which scenario should the nurse question the prescribed treatment for eczema? A. Topical corticosteroid prescribed for red inflamed lesions. B. Antihistamines ordered for itching relief. C. Order for bleach baths twice weekly. D. Daily application of alcohol-based sanitizer. Answer. D. Daily application of alcohol-based sanitizer. Question 17. Which environmental control is best for preventing eczema flare-ups? A. Use a humidifier in dry weather. B. Keep room temperature high. C. Open windows during pollen season. D. Vacuum weekly using standard filters. Answer. A. Use a humidifier in dry weather. Question 18. A patient with eczema asks how to avoid triggers. What should the nurse include in the teaching? A. Avoid wool and synthetic fabrics. B. Use strong detergents for clothing. C. Take frequent bubble baths. D. Apply perfumed lotion daily. Answer. A. Avoid wool and synthetic fabrics. Question 19. Which complication is the nurse most concerned about in a child with eczema and frequent scratching? A. Sleep disruption. B. Secondary infection. C. Poor school performance. D. Dietary intolerance. Answer. B. Secondary infection. Question 20. The nurse is reviewing eczema management with a group of parents. Which statement by a parent indicates a need for further education? A. I'll use a humidifier in my child's room. B. I will let my child scratch if it helps him sleep. C. I will apply moisturizers after his bath. D. I'll keep his nails trimmed short. Answer. B. I will let my child scratch if it helps him sleep. Question 21. The nurse is preparing to educate a patient on managing chronic eczema. Which teaching point is essential to prevent skin breakdown? A. Use a humidifier during winter months. B. Limit fluid intake to reduce swelling. C. Take cold showers 3 times a day. D. Apply moisturizer to dry skin before showering. Answer. A. Use a humidifier during winter months. Question 22. A nurse is supervising a new LPN caring for a child with eczema. Which action requires the nurse's immediate intervention? A. Applying a thin layer of prescribed steroid. B. Bathing the child in lukewarm water. C. Using powder to keep the skin dry. D. Assisting the child with applying emollient. Answer: C. Using powder to keep the skin dry. Question 23. A patient with eczema reports severe itching. Which intervention should the nurse prioritize? A. Administer prescribed antihistamine. B. Apply cool compresses. C. Encourage the patient to scratch with gloves. D. Instruct the patient to take a hot shower. Answer: A. Administer prescribed antihistamine. Question 24. A nurse is assigning care for 4 patients. Which patient with eczema should be seen first? A. A patient with mild itching requesting lotion. B. A patient with signs of infection on lesions. C. A patient who skipped a corticosteroid dose. D. A patient needing assistance with bathing. Answer: B. A patient with signs of infection on lesions. Question 25. A patient asks how to prevent nighttime eczema flares. Which is the best advice? A. Apply moisturizer and wear cotton gloves to bed. B. Sleep with a heating pad on the affected area. C. Use an alcohol-based skin cleanser. D. Wrap lesions with plastic overnight. Answer: A. Apply moisturizer and wear cotton gloves to bed. Question 26. Which instruction should the nurse give to a parent about bathing their child with eczema? A. Use mild soap and limit bath time to 5 to 10 minutes. B. Use hot water and scented soap to soothe itching. C. Apply lotion an hour after bathing. D. Avoid bathing the child more than once a week. Answer: A. Use mild soap and limit bath time to 5 to 10 minutes. Question 27. The nurse observes an eczema patient scratching despite treatment. What is the nurse's best initial action? A. Assess for possible trigger exposure. B. Increase corticosteroid dose. C. Restrain the patient's hands. D. Apply ice directly to broken skin. Answer: A. Assess for possible trigger exposure. Question 28. Which home modification would most benefit a patient with severe eczema? A. Install a humidifier in the bedroom. B. Use wool rugs and bedding. C. Keep windows open year-round. D. Clean using heavily fragranced products. Answer: A. Install a humidifier in the bedroom. Question 29. Which patient behavior indicates a need for further eczema education? A. Wearing gloves during sleep. B. Using unscented moisturizer twice daily. C. Applying corticosteroids directly after lotion. D. Using mild detergent for laundry. Answer: C. Applying corticosteroids directly after lotion. Question 30. Which priority outcome should the nurse establish for a child with eczema? A. The child will have intact skin without signs of infection. B. The child will verbalize reduce stress. C. The child will demonstrate proper hand washing. D. The child will consume a high-protein diet. Answer: A. The child will have intact skin without signs of infection. Question 31. A nurse caring for a patient with eczema should question which order? A. Diphenhydramine for pruritus. B. Topical corticosteroids for flare-ups. C. Daily hot water baths with soap. D. Moisturizing twice daily with emollients. Answer: C. Daily hot water baths with soap. Question 32. The nurse is assigning care to the UAP. Which task is appropriate for a patient with eczema? A. Apply prescribed topical corticosteroid. B. Monitor for worsening rash. C. Report signs of skin breakdown. D. Educate about eczema triggers. Answer: C. Report signs of skin breakdown. Question 33. Which patient statement shows correct understanding of eczema treatment? A. I will apply lotion after every bath. B. I should scrub the rash daily to exfoliate. C. I will use perfume daily to mask odor. D. I can use any over-the-counter antibiotic cream. Answer: A. I will apply lotion after every bath. Question 34. The nurse is reviewing documentation on an eczema patient. Which entry is most concerning? A. Patient using unscented soap and moisturizer. B. Patient reports increased itching after wool clothing. C. Patient applies corticosteroid twice daily. D. Patient reports applying lotion before showering. Answer: D. Patient reports applying lotion before showering. Question 35. Which nursing diagnosis is most appropriate for a patient with eczema? A. Risk for impaired skin integrity related to pruritus. B. Risk for fluid overload related to steroid use. C. Risk for constipation related to antihistamines. D. Ineffective breathing pattern related to inflammation. Answer: A. Risk for impaired skin integrity related to pruritus. Question 36. A nurse is educating a teen with eczema about skincare. Which statement indicates understanding? A. I'll avoid lotions during breakouts. B. I'll take hot showers every morning. C. I'll keep my fingernails short. D. I'll wear synthetic fabrics to prevent rubbing. Answer: C. I'll keep my fingernails short. Question 37. Which intervention is most effective in reducing eczema-associated pruritus? A. Apply antihistamines before meals. B. Moisturize the skin immediately after bathing. C. Allow skin to air dry after showers. D. Use harsh soaps during flare-ups. Answer: B. Moisturize the skin immediately after bathing. Question 38. A nurse is caring for a patient with eczema who develops a fever and spreading redness. What is the nurse's priority action? A. Document findings in the chart. B. Notify the healthcare provider immediately. C. Encourage fluid intake. D. Apply warm compress to affected area. Answer: B. Notify the healthcare provider immediately. Question 39. A child is hospitalized for infected eczema lesions. What isolation precaution is most appropriate? A. Airborne precautions. B. Contact precautions. C. Neutropenic precautions. D. Droplet precautions. Answer: B. Contact precautions. Question 40. A nurse evaluates discharge instructions for a patient with eczema. Which response indicates a need for follow-up? A. I will wash all new clothes before wearing them. B. I will keep my home environment humidified. C. I will apply moisturizer after showering. D. I will stop all treatments once my skin clears. Answer: D. I will stop all treatments once my skin clears. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!